Fine.
Hi, I'm Suzanne, and this is Supercharge Your Health. You can like us, subscribe, share on either the videos or the YouTube or the podcasts. You can find me at Discount Med Direct at 2414 Tamiami Trail, Unit 1 in Port Charlotte. You can call me at 941-421-7155. And my partner in crime,
Beth Annie Stockdale, owner of Your Total Body Wellness Center, and that's where we're broadcasting from today. And you can find me at 800 East Venice Avenue, Suite C in Venice, Florida, 34285. Yes, please like Supercharge Your Health. We're on episode what?
34. This will be
34. So you have 33 episodes to get caught up on everything except acupuncture regarding your health that will just, these are, and I make fun of myself every week because some of these modalities are new to me, but they've been around for thousands of years. And that may be the same thing with you, especially with acupuncture. Maybe one of those things you've always heard about and heard weird things about and are curious about and or seeking an alternative to pain relief and depression and anxiety. And we have one of the experts in the field with us here today. Yay! Dr. Karen Helmick.
Thank you very much.
She's an acupuncturist, a doctor down here in Englewood, Florida. So I'm just going to take it over to you and say thank you so much for being here.
Thank you very much for having me.
Oh, this is so exciting. All right, yeah, because I am always excited about everything. All right, so we're going to talk about Acupuncture 101. So for our listeners and our viewers that have no idea what acupuncture is, take it away.
Acupuncture has been around for thousands and thousands of years.
Told you.
It is one of the oldest, if not the oldest medicine there ever is, except for food and nutrition as a medicine. But absolutely, it has been around for thousands and thousands of years. They actually dug up an Iceman who had tattoos, and they were actually put on acupuncture points, and they were able to say definitively, they asked a couple of acupuncturists, what are these points actually denoting or treating for this person? And they said, oh, it's IBS or Crohn's or something like that. And then come to find out, they actually did a little dissection, and sure enough, that's exactly what that guy was suffering from all those thousands of years ago. Wow. So the points have remained the same. We have found out even more research and continue to find out even more proof and research behind the acupuncture. Before, when China was kind of closed off, it was more difficult to do research because they were very closed as a culture. As a culture in China, doctors are reserved almost like a godlike position, and you do not question the gods. What they say, it goes. And so what we now have done since the 60s, when Nixon actually got acupuncture, he was one of the first Americans to travel over there.
Oh, wow.
And he got acupuncture started kind of here in the U.S. and kind of tickled our brain as to how could this be helpful for the American population. And so with that, we've started to do a bit more research, and we are finding good, solid proof that certain points will do certain things. We've always known it anecdotally and through case studies, but now we absolutely have proof. So we know that 3 different points on your leg are going to increase the amount of dopamine that you have in the brain.
All right, so we got to take another step backwards.
Yep.
Exactly what is acupuncture?
So acupuncture uses
Before we
little
start talking
tiny
about that.
acupuncture needles that just barely penetrate the skin. So they are between the skin and muscle layer most of the time, unless we're doing a trigger point therapy where we actually go into the muscle to try and get that muscle to release. So they are between the skin and muscle layer. They are about the size of a puppy's whisker, so they are teeny tiny.
That's tiny.
So 30 of them will fit into the traditional hypodermic needle that most people are picturing in their head. So 30 of my needles will actually go in there into one of those hypodermic needles. So I wish that people would kind of, I wish we could call them something different other than needles, because needles have a very scary,
Yeah, a lot of people are scared of needles.
Absolutely.
Right.
Absolutely.
So
Are they disposable now, or do you?
Yes. In this country, we have to have disposable needles, which I prefer, because that means that they can be so tiny. If they have to be reused and sterilized and all the other stuff like they do still in some parts of China, they have to be the thicker needles to withstand that kind of sterilization processes. So I'm so relieved that we are able to use disposable needles every single time.
all right. So how do you decide where on the body to put the needles?
Good question. So there is a three-prong intake that I actually use in my office. Number one is our little questionnaire as to what's going on for you. And for some of the questions, I've kind of simplified it for pain patients. But if you're there for IBS, it's much more detailed intake, because we're trying to look at everything that is going on in the body.
And we'll go into more detail later about all the different conditions that acupuncture can address, but just explain the process of where the needles go.
Yes, so
and the body anatomy.
after the intake, we kind of get a picture of what your classroom looks like. So if we talk about acupuncture, we're talking about different organ systems being out of balance or in balance.
There you go.
And so we talk about the fact that we all have a classroom of students, and they're the same number of students, and they're named after the different organ systems. So we would have the spleen, we'd have the kidneys, we'd have the liver, we'd have the lungs. And so for each of us, we all have those straight A students that are doing really, really, really well. And you might say, oh, my body is just such a mess that I probably don't even have those straight A students. Everybody's got straight A students. And then everybody's also got those students that are kind of like, oh, we kind of need a little help. We kind of need to be sent to the principal's office, or we need to have a conference with mom and dad because we need something else to go on. So we determine who those are for you based on, your intakes. So the second way that I would actually intake after the questionnaire and the paperwork that you have to fill out for every doctor's office would be to take a look at your tongue. So the tongue represents everything that has gone on in your life, not only your congenital stuff, which you were born with, but everything that you've done up until this point. So if you're a person who never has historically slept well, it will show up in your tongue.
Oh my gosh.
And if you're a person who consistently craves chocolate, that
You're
will
low
also
in
show up in
magnesium.
there.
That was another program. You're low in magnesium if you're craving chocolate.
And it's delicious.
Dark chocolate, 70% or higher, and then work your way up to 85%.
So it's almost like a tree. So if we're looking at the tree and we've cut it a slice section, we can see the rings of the tree. So it's the only internal organ that we could readily see back 3,000 years ago, before the whole CAT scans and x-rays and everything else. So it's actually mapped out as far as where your organs actually lie. So the tip of your tongue is the heart. Wrapping around the tip of the tongue are your lungs. And then the sides of the tongue are actually the liver, because they thought we had two livers way back when. So they have the job of the spleen and the liver kind of overlapping.
So you can look at the tongue and determine where a person's imbalance is in which of the organs.
Exactly.
Oh my God.
Exactly. And because everything is fluctuating, everything is changing from day to day, we juxtapose that with the pulses. So the pulses tell me minute to minute, second to second, what's going on with that person. Oh, wow. So while this might be their constitution, this very day they might need something else. So if I'm again using the classroom analogy, traditionally this student needs a little more help in math, say, but and so that might be what we're seeing with the tongue. But if I'm the principal and I take a look in that classroom that very second, even the straight A student might be throwing a spitball that day. So that's why we kind of take a look at the pulse as well.
Right. Because
So do you do just the pulse in the wrists, or do you do multiple?
We do the pulse in the wrist, but we do it in 3 different areas on each wrist, and then we do it at 3 different depths, because each place in each position tells us about a different organ system as well. So
Right.
that's also mapped out also.
And, you know, we in our prior episodes, we've talked to chiropractors and whatnot. So we can talk about organ systems. We can
Absolutely.
talk about, let's talk about meridians. Let's talk about how the meridians are connected.
Absolutely.
Because I know when they were with some circulation issues with my dad, they would take his pulse and his ankle too, just to check.
Yep.
Yeah.
And that's also a good pedal pulse so that they can check blood flow. So we have to have quite a bit of Western doctor training as well. I am not on par with a Western doctor by any means. I'm not saying that, but we've had to have a lot of classes with that. And so that's another place that's very easy for us to check and a very easy way for us to say, okay, are we in fact getting more restored blood flow to that area or are we not? And
There
so
you go.
that would also be a good way to diagnose that.
All right. So can you explain, since I mentioned it, can you explain what the meridians are?
So the meridians are like pathways. They are like roads in your body. So they are communicating directly with that particular organ system. They also communicate with the brain and they communicate with each other. So it's very much like they have many different exit points and entry points as well. So certain points in the body, certain acupuncture points will treat a variety of different things. For example, stomach 36, which is located just below your knee, 3 of your finger widths away from the knee on the outside of the shin bone. This is known as the point that cures everything. It is the bomb. If you only have to ever use one point in your whole life, they would always tell you to use this one as a health point.
So what is it about that meridian? What's it connect to that is like the universal spot?
Yep, so that is basically, it's the stomach channel, which is full of chi and blood. So that is our vital essence and restoring our vital essence. So it boosts your immune system, it keeps you healthy, it helps with digestion.
So should we just be pressing on that all the time?
Absolutely. And in China, they'll actually, in Chinese culture, I should say, so not just in China, but a lot of folks will actually warm that area all the time. So they'll actually use a substance called moxa, and they'll warm that area to the point where sometimes you'll even see a little scar there on their leg because they've done it so much and they just, they haven't paid attention and it just burned their skin a little bit. So they'll actually warm that area, but using it as an acupressure point would be wonderful.
And so we keep doing these little sidebars, but
I know,
that's okay. So you can get the benefit from acupressure without the needles
Absolutely.
of acupuncture because
Absolutely.
those same points along those same meridians are the same whether you're putting pressure on them or inserting a needle.
Correct. And a lot of times with children, we are more interested in doing acupressure than acupuncture. We definitely do experience a little bit more of a, stronger stimulation with the needles, which most people, once they've gotten, past their 20s or so, you kind of need a little bit more of a boost than a child who has their energy circulating very quickly as well as more towards the surface. Not to say that acupressure is not as helpful or can't be as helpful as acupuncture, but for a lot of people, the acupuncture tends to be a little bit stronger effect.
But something like that you could do in between visits.
Yes, please, by all means. And then the other thing that we were wanting to cover and wanting to talk about was actually ear seeds. So there's a couple of different ways that you can actually boost yourself between treatments. So my job is to keep you out of my office and recruiting more patients for me. I don't like to see you.
You're helping more people.
There you go. There you go.
People.
Sharing the wealth. I always tell my patients, I'm like, okay, let's make you better. And they look at me funny, and I'm like, no, I have a different philosophy than traditional Western doctors that want to keep you coming in to see them. No.
My business
I want to see your friends.
My main business is discount medications, but we've often said, even my business partner and I, if we could make everyone healthy and put ourselves out of business, that would be a good thing.
Exactly.
And we would just move on to something else.
Exactly.
We're more than happy to move on to
your essential oils.
We'd move on to something else.
The biomass.
Whatever. But if we could make everyone healthy so that they didn't have to come and visit us, that would be an amazing thing.
Yes.
I totally agree.
Okay, so you're talking about ears
Yes.
and seeds. So go ahead and explain that
So-
procedure.
It is a form of acupressure, and there are different microsystems of the whole body. And so, if I didn't bring my good example, but if you look at the ear in your mirror, go ahead and take a look at your own ear. It actually looks like a person in a fetal position. So the head would be represented here, spine here, and it's almost like they're curled up into a little ball. So heart would be in the center here, and then all the other vital organs in the center of your ear. So we can actually do a little stimulation of that through our between treatments by placing little ear seeds there. And then you kind of remember throughout the day and just give it a little press. And you can press and hold it for about 10 seconds. So and that has some good effect.
And there's like little seeds, like metal, like little bearings or
Yes,
metal balls
yes,
kind of things.
yes.
And it's just acupressure.
Absolutely.
That's all it is. Oh my God, this
Absolutely.
is fascinating. All right, so what happens with those of us that have multiple ear piercings? What have
Oh.
I know, I knew you were going to do that. I knew you were going to do that. What have I done to myself?
Well,
This is for any young people that are considering getting multiple piercings. Go.
so this is a great question, because a lot of my patients suffer like I did with headaches and migraines. And so they'll get the piercing that is through this area right here of their ear, through the cartilage. And it does help short term. Because again, you have that acupressure going on, you have that stimulation of the nerve. What unfortunately will happen is that those migraines will return because we haven't fixed the issue, and now you have to find where that point moved to, because our nerves will regenerate and regrow. And so now I have to kind of hunt and peck for where to actually place a seed to stimulate from now on. And if you keep piercing and keep moving that point, then you run out of space, basically.
Am I damaging those nerves?
You have initially, however, it does reroute itself. So
Okay.
it's not,
Yay.
Initially it's kind of like overstimulation, but then as it's rerouting, you're missing that point for a little bit. And then it will go ahead and regenerate.
Because I have a friend who had double piercings and was getting horrific vertigo.
Yes.
And she finally, I don't know if it was a chiropractor or it was another acupuncturist, told her to take out that second piercing. The
Correct.
minute she took that second piercing out, she was fine.
Yes, that is a very, very big vertigo point. Is
Okay.
actually up towards the where the lobe actually meets the cartilage there. That's actually a
that's
big
right.
vertigo point. So if you are experiencing any vertigo, go ahead and press right there where your fleshy part actually meets the cartilage right here. And just kind of even press in with your nail, or just kind of stimulate it and rub it a little bit. That should help the vertigo to subside just a little bit. The other thing is we have the vagus nerve that is coming out right here,
There
just
you go.
below our ear. And so if you're having vertigo, make sure to stretch that and to stretch out these SCM muscles that actually join here. A lot of times we'll clench our jaw throughout the evening, and that can also tighten up and then make that vertigo even worse. So these are just some helpful tips that you can do.
I'm gonna have to
because
send this. I have a
it's
friend
kind of a
that's
crisis.
been dealing with vertigo recently, so I'm gonna have
Ah.
to specifically send this episode to her.
Right,
Yes,
right.
please
So,
do.
so speaking of, all right, so acupuncture is the use of these tiny little needles. They go in according to specific spots, and we'll talk about this in a second. But your meridians run, and correct me, from your feet through your body, out your hands,
Yep.
and they connect the different organs.
Correct.
Like I remember
Correct.
when I was having issues with my shoulder, the point that he was putting the needle was in the side of my knee. I'm like,
Yep.
right?
And a lot of
so-
times the most effective point to use is not where you're experiencing the most pain. So we like to go to the source, or as far away as possible, because we're kind of directing the soldiers away from that area, directing that inflammation away from the area of most discomfort.
Can you explain the correlation between using acupuncture or acupressure and blockages in these meridians?
So anytime that you have a malfunction or pain or discomfort, we're talking about there being a blockage in traffic. So think of it again as these are meridians are roads, and you have a traffic accident that's happened along that road. So what we're trying to do with the acupuncture is to either call in, some more ambulance, tow truck, background, all that stuff, to do so by doing a point farther away, or we can actually work directly at the area. So I like to do both. I like to do a little bit of both, as long as that person is not in severe discomfort, or I can't access it because they say broke a leg and it's casted now. So in that circumstance, I'll actually mirror it on the other side. And so let me back up. During my externship while I was still in school, I had the opportunity to work at what was called Health South. Now it's called, I forgot.
Something else.
I forgot.
It's got another name.
With a lot of amputees. And with that, we could clear phantom limb pain, and sometimes for months on end, just with one treatment, because we re-educated those nerves by actually using points on the other side and calming those nerves down. It sent a signal to the brain that said, turn this off, please. And so we were able to get them out of discomfort very, very quickly. So that was very rewarding.
Now, talking about the different ages, and you were talking about using acupressure with kids, what about elderly? In our area, we have a lot of senior citizens. We have a lot of places like Health South and other facilities that people live in. With an older person that has thinner skin and stuff, would you use the needles, or would acupressure be better for them?
Actually, acupressure would be worse for them, because it would tend to actually break up some of those capillaries a little bit more. With how fine my needles actually are, they are perfectly safe for anyone on any kind of blood thinners or anything else. They go between the skin and muscle layer. They usually do not touch any of those capillaries or blood vessels.
This is awesome.
So very rarely do we have any kind of bleeding. Very rarely do we even have any kind of bruising afterwards. Every once in a while, it's my fault, and I leave just a tiny little bruise because I just did not see that one little capillary that's there. But it's very rare, and I treat people all the time that are on blood thinners and everything else with great success.
All right, so the big umbrella question is, what are some of the conditions that people have out there generally, and then which ones would you not normally think about?
Gotcha. That's a great question. So what brought me to this medicine was actually I suffered from really terrible migraine headaches that Western medicine just was not getting rid of, and it would clear up occasionally, but not always with the medication, and I would be violently ill. I actually had a Western medicine doctor sit me down and say, these are verging on transischemic attacks. You are having mini strokes. You are in big trouble. You need to figure out a way to get rid of this, and
a doctor was telling you that you had to figure out a way.
I'm like, okay.
You're the doctor. Yeah.
So I was a needle phobe before this, believe it or not. I really was. I was just kind of like, I really don't think so. But then I went ahead and tried it, and sure enough, after that first visit, I had relief.
Oh, wow.
I had significant relief. And I was talking about having migraines and headaches and to the verge of TIAs, where it was putting me down once a month for days, like 3 days at a time. And it was very, very regular. So I had that happen, I'm thinking it's 11 years now. And that's been my anniversary where I have not had those kind of migraines ever since. I had one since where I triggered it myself with foods, but that was me. And that was on me.
But you know what? And that brings up a good point. That, again, little sidebar, that a lot of migraines are triggered by food sensitivities.
Absolutely.
The same thing with coughs and whatnot. So food sensitivities, There's another episode.
Yep.
Okay.
Yep.
Put it on the
Yep.
list. All right.
So some of the other,
Yeah.
definitely, I found relief with it. A lot of my patients have found tremendous relief with it. Another one of my specialties that people don't tend to think of immediately is Parkinson's. I do treat Parkinson's really, really well, and especially side effects from Parkinson's. So our main goal is not to cure Parkinson's, but to get them living as comfortably as possibly, as happy as possible, because that's also another huge thing, and as comfortable as possible, because another big thing that I always see with my Parkinson's patients is that they're constipated. So that's another big thing that we try to work on as well through herbs, through acupuncture. We can usually get that to happen as
Does
well.
it help with the tremors?
Yes, ma'am. Absolutely, it does.
Because, a little segue. I'm a certified brain health coach, and I've done presentations up at Parkinson Place two times, 3 times. So I'm familiar with the whole Parkinson thing. Now, before, like maybe even when we first started this broadcast, you said something about acupuncture stimulating dopamine. Parkinson's is tied to a dopamine deficiency.
Absolutely.
So, yeah. So we could go on about acupuncture and ADD.
Yep.
And depression. Okay,
Even anxiety.
Yep. Okay.
All of those. All of those.
Okay.
Absolutely.
So it's not just the physical pain stuff,
Nope.
it's the emotional brain cognitive stuff also.
Absolutely. I like to say that anything in Western medicine that they treat, we treat as well. The only thing that acupuncture is not real great about is changing structure. And
Well,
so
yeah.
a lot of people that come to me with significant pain, I can relieve the pain temporarily, but I cannot change structure. So if the
Right.
pain is a result of the fact
The
that
misalignment.
misalignment,
Right.
and that's why it works so well with chiropractic, with what you do, which is retraining the muscles so that they can actually hold those adjustments, or to retrain so that we can hopefully have that bone in a different position,
Right.
and posturally we can be different. So
Right.
we can definitely make some changes, but I like to say I don't change structure.
So like I have a friend that had shoulder replacement. She fell and
Correct.
broke her shoulder, but she's now having lingering pains, and because it took
Yep.
her so long to get the shoulder replacement, she's having neuropathy in her
Yes.
hand.
So both of those two things we can absolutely work on and improve tremendously. So I also use some cold lasers and different things like that I have in my office as well. But absolutely, even just the acupuncture has worked phenomenally well for that. But yes, and even to an extent, releasing that muscle and retraining it to accept the new configuration that's there.
Well, she's doing pretty good with as far as like
Good,
movement
good,
and that
good.
stuff, but
So the tingling and the numbness and everything, and correct me if I'm wrong, means that there is some blockage
Correct.
along these pathways
Correct.
that the acupressure can now open up those pathways again
Correct.
to get more circulation. So because of the surgery, there may have been now something that got twisted, it's pinching off.
Well, and I like to
whatever.
always say that it's almost like when you have neuropathy, it's almost like if you're looking at a cord, that cord has actually frayed, the outside coating.
Okay.
And so what acupuncture can do is to repair that fray, so that we are not only regenerating the nerve, we're improving circulation, we're trying to improve and make sure that the inflammation is down, and trying to relieve that blockage as well. So it's kind of like a threefold approach to
well,
that.
and hers started not so much after the surgery, but before, because she went so long
Gotcha.
between breaking it and surgery, and it was
Yes.
in the sling
Yes.
for so long.
Yes.
That's when she started feeling the issues
Yes.
with the
And if
hand,
we-
because she wasn't moving it. She couldn't move it.
Right.
And if we pinch off the water supply to a plant, you're going to have the same thing, that wilting of the plant. And so it's trying to regenerate. It's just not there yet.
All right, last question, because this is another baby of mine. Hormone optimization.
Oh, yes.
Can you use acupuncture
Yes.
for
Yes.
hormonal?
100%. 100%. I love it. I love it. I love it. And the changes are phenomenal. So that's another thing that I actually work on quite a lot, is either the transition that menopause provides us with,
As
or
women?
or
Which I'm
even
refusing.
or even PMS and trying to get pregnant and fertility and that kind of stuff. So on both sides of the coin, absolutely acupuncture helps to balance those hormones.
I would think for fertility that it could probably be kind of amazing, because
Yes.
if you had some blockages in
There
flow,
are actually studies that acupuncture improves the results of IVF treatments by up to 60%.
awesome.
So you are spending a huge amount of money. Please go get acupuncture,
Right,
and improve
right.
your chances by another 60% of becoming, and being able to carry pregnancy.
How about generalized stress?
Oh, yeah. Yeah. And right now we're living in very anxious times. So I always, always, always include points for that, whether or not the patient has actually verbalized that. And we call it our dopamine high as we're riding out of the parking lot. You feel really good.
Well, we talked about that, but right before we started, that I was a test dummy at a networking event for what you called the happy point on the top of your head. That the acupuncturist that was the speaker for that particular engagement wanted a person who had acupuncture, so she did one right on the top of my head while we were in this meeting.
I love it. Absolutely. And if you're ever trying to remember something, just tap on the top of your head or just kind of scratch it inadvertently, and hopefully that thought will come to you.
And one last general type question. What's the difference between acupressure and reflexology?
Reflexology deals with just the palms and feet of a person. With acupressure, it's the whole body. You
Okay.
can use any point on the whole body. So they overlap, but they're not exactly the same. They're using microsystems for the reflexology.
Okay. All right. So, if you want to try reflexology and not getting the results, acupressure. So you can have just acupressure
Yes, ma'am.
sessions with folks.
Mhm.
So if they're not ready to jump into acupuncture, we can start with the acupressure.
Absolutely. And there's even a treatment using magnets. It's a Japanese style treatment, and we can actually just tape some magnets to you. So no invasion whatsoever. You relax, and we just get that energy flowing a little bit better.
What does the magnets do?
So the magnets, again, are doing the exact same thing that acupuncture does. It's just rerouting the flow of that energy. Because there's always a pull between those magnets.
Now, left hand or right hand?
For
Magnets.
Ah.
Like if people are wearing bracelets, this is one is for EMFs.
Mhm.
But for those people that have arthritis or whatever, and they're wearing the bracelets that have magnets in them, is there a difference between left hand and right hand?
Absolutely there is. But if you have any kind of arthritis in your hands, whichever hand is worse, to test it out, I would use it there.
Okay.
And then if it's on both hands, just wear them on both.
Okay.
Wear them on both. And then for EMF stuff, I would say whichever is your dominant hand, I would wear it on that.
Oh, okay. I was always told that the energy comes in through your left and out through your right.
It does, and that's how we needle, but
Okay.
in practicality, we're trying to block. So we're trying to block things, and if you're more dominant with your right hand, even though that is our receiving hand with your left, I would put it on your right.
Oh, okay. There you go.
Because again, we're receiving from people, from other things that we
Right.
touch all throughout the day as well. So,
Okay. There you go. All
Is there
right.
anybody who shouldn't have
oh, very
acupuncture?
good question. And the
We
answer
kinda-
would be no.
We kind of touched on a couple of the things like medications
cardiac,
and
Yeah.
medications, anything,
And
any
the only-
contraindications?
No. The only contraindications are certain herbs will have interference or interactions with certain medications. And your licensed acupuncturist knows what those are very, very well, because we we have it drilled into us multiple times every year. And that's something that we are very, very well aware of. There's no contraindication to the actual acupuncture.
So for the procedure, there are none. any
But if you
supplemental
do
herbs or whatever
herbs or
that you would
supplements, then
add
yes.
as an adjunct.
Yes.
And that's something that most acupuncturists do, is herbal medicine as well.
Correct. I like to start with the acupuncture, see what kind of changes we get with that, and then the second visit go ahead and add in the herbs to kind of help clear out anything else that's remaining. And so I like to say, this is how much progress we made with just the acupuncture. If we add the herbs, then we'll know separately, how much that actually helps you as well. So it helps to solidify it with the patient as well, because they're like, wow, okay, those herbs really changed this and this, and the acupuncture is
Right, so they know
responsible
the
for that and
difference,
that. Yes.
And all of these modalities work synergistically together.
Absolutely.
Number one. Number two is nothing happens in isolation.
No.
If you're dehydrated and you go to try to get an acupressure session, what's going to happen?
Not very good things.
Not a good thing. So, there's some common things about nutrition and hydration and sleep, and all those
Absolutely.
good things. Oh, can you treat sleep?
Yes.
Sleep.
Yes.
Okay.
Tremendously well.
Snoring, sleep apnea?
We can help with that, but it's going to be more short term, because a lot of times that is more structural related,
Oh,
or weight loss will actually help with that as well. So,
Yeah.
yes, all those things.
And I just want to say this is a perfect time to have a Chinese-based episode, because we're in the middle of the mid-autumn moon ceremony in China.
You're awesome.
Did you know that?
People don't know that.
I actually have a Facebook friend that's living in Singapore right now, and she put it on there this morning, so I saw it this morning, and they make these altars and put out moon cakes.
Very cool.
Yes. So now I want moon cakes. I don't know where to get moon cakes, but
the other big thing is that
I think you
because
need an acupressure session. Get rid of your craving for moon pies.
moon pies, moon cakes, they're completely different.
Oh my
It
goodness.
sounds like sugar to me. All right.
It does have sugar in it. I have to say, I looked at that.
Absolutely.
All right, we're going off on
But you only eat one. You just eat one little one as a ceremony.
Beth does not approve this message.
You stevia. Right, I'm like stepping away from this one. All right, so here we are. It's Supercharge Your Health. We're going to cut it off now before we start talking about more sugar. Beth Annie Stockdale here at the Your Total Body Wellness Center. Thank you for watching our episode on acupuncture and acupressure and seeds on your ears and all sorts of things that are going to help you just supercharge your health. I'm at the Your Total Body Wellness Center, located at 800 East Venice Avenue, Suite C, here in Venice, Florida, 34285. You can call me, text me, 941-468-7091. Email yourtotalbody@yahoo.com. And Suzanne.
I am Suzanne with Discount Med Direct. You can reach me at 2414 Tamiami Trail, Unit 1. Phone number is 941-421-7155. You can reach us here at info@healthsupercharge.com. We are on Facebook at Supercharge Your Health. And
Dr. Karen, how do
I
people
am.
get in hold with you?
Dr. Karen Helmick, and I work out of Healthy Body Acupuncture, and it is here in Venice. My number there is 941-228-2688, and you can reach me at Dr. Karen Helmick, HELMICK, @gmail.com.
And your
Thank
website?
you so much. Acupuncturevenice.com.
Very good.
And we will make sure to link all of that in the
in the comments.
for everyone.
Thank you so much.
And again, if you have any questions about what we talked about today, do not hesitate to reach out to Dr. Karen, myself, Suzanne, comments on the YouTube, wherever, and we will get back to you, because our wish for you is to be well, to feel well, and to stay well.